Forum is typically, and like it is this year, it's a 2-day event where our members have the opportunity to come into Washington, D.C. We spend our first day educating folks on what the issues are that we want them to discuss with their legislators and what we'd like them to do when they go up to Capitol Hill. And our second day, our members take that message up to Capitol Hill where they meet with their legislators or their staff and tell the story. Talk about, this year we're talking about the Medicare AOPA Patient-Centered Care Act. But how do you go and how does advocacy bring change? We go up on Capitol Hill, we talk to the legislators, we tell them what our stories are, we tell them what our issues are, and we ask them to help us change the system. Legislation creates the statute then creates the regulation then leads to the policy. So it's all related, it's all intertwined. How can we get effective change at the statutory level, the legislative level, that's then going to impact things at the policy level? That's the goal.
Be prepared. Do your homework. That's why we're here. Select your spokesperson. Be brief, but stay focused. Personalize your issues. Be positive. React honestly. Be friendly with legislative staff. Even the person who welcomed you to the door. Close the deal. Remember your ask. Leave behind materials, we will provide them for you. And always say and write a thank you.
So to set the stage for our visits tomorrow, I want to briefly mention what we've accomplished in the last year related to the Medicare AOPA Patient-Centered Care Act. Thanks to your support, it was a lot. The Medicare AOPA Patient-Centered Care Act saw more momentum and more support than ever before. We strengthened our relationships with our champions, we developed relationships with new champions, and we garnered more co-sponsors in both houses from both sides of the aisle than ever before. We engaged constantly with our sister societies, with organizations within AOPA to be sure we spoke with one voice whenever any of us were on Capitol Hill. We worked tirelessly with organizations across the rehab space to be sure that we didn't necessarily just settle for no opposition to the bill, but we worked with these groups to make sure we had full energetic support for this bill. And I'm looking forward to building off these efforts and continuing to advocate together for the needs of the profession and the patients that we all serve. Advocating for the needs of our members and their patients and the profession is AOPA's highest priority. As AOPA's Advocacy and Health Policy staff team, which, by the way, represents over half of our staff team, we spend countless hours each week advocating at the federal and state and regulatory level, addressing legislative and regulatory issues on your behalf. And to that end, in the last few months, we have been hard at work getting the Medicare AOPA Patient-Centered Care Act ready to be reintroduced in the 118th Congress, with the ultimate goal of seeing the Medicare AOPA Patient-Centered Care Act passed this Congress.
Has three very, very patient-centric provisions. First one is an extension of the exemption from competitive bidding for OTS orthoses for orthotists and prosthetists. What that will do for patients is it'll allow them to not have to go to multiple providers to get services that are related. So if a patient needs a prosthetic limb and they also need an OTS orthosis, this will make it easier for them to get that service at their OMP facility. Second provision is all about fraud and abuse. It prohibits drop shipping of other than off-the-shelf orthoses. Anything that needs the expertise of a clinician, AOPA doesn't believe should be simply just shipped to their house in a box with no instructions on how to fit or how to use. Final provision is a new one this year. We're really excited about it. And it's a provision that will take away the default 5-year reasonable useful lifetime that exists for orthoses in the Medicare program. We'll make the decision, or bring the decision back to the physicians and the orthotists and prosthetists that are treating the patients.
Hey everyone, thanks for coming along with me to Washington, D.C. and to AOPA's Policy Forum. I hope that it was informative and that you'll consider participating in it next year. So now what we need you to do, now that the bill has been introduced in the House, we need your support. So please click on the link that I've put in the description of this video and follow along. It only takes just a couple of minutes, and make sure that you tell your own story about how this is pertinent to you and your life. Because that's what your legislators want to hear about. Also, as you click on it, make sure that you put in there that you would like to receive updates on the campaign, so that way when it's introduced into the Senate, you can also go back on and ask for support from your senators. Thanks a lot, and we'll see you next time on the next episode of The Dish with Denise.